What do you think clinicians get wrong when we think about this as an addiction or, that kind of thing?
I think even just the word addiction, it sort of
Right.
implies that it's, very similar to kind of, chemical substance, and that if you just sort of remove the thing that's causing the addiction, then that'll solve the problem. And that's really what the
Yeah.
sex addiction model started in. It was just basically, let's take substance addiction and apply it to sex. And so it was very sex negative, very abstinence only. And I was actually in that world. I did a postdoc in that world, and I saw,
Mhm. Okay.
going through continually relapsing back into old behaviors. So I think for clinicians to know that a lot of it's based on early trauma, early attachment wounds. It's not
Mm.
just about an addiction that got out of control. A lot of it is, kind of diving deeper into a person's early life and their
Mm.
early behaviors. I think at the core of most of these compulsive behaviors are intimacy disorders. And the more you heal and create, healing around intimacy and education around intimacy, the more people are able to overcome these concerns. So I think the sex negative sex addiction model has actually done a lot of damage. It's created more stigma and more pathologizing,
Sure.
and it hasn't had a great success rate. So I think that was the big piece that was missing when I was in that field was we have to create some way for people to get healthy sexuality and
Yeah.
not sort of demonize sex or porn or masturbation as these things that we can't control, but give them some resources and ways to understand what their behavior is telling them, or what is their behavior stemming from.